Hello everybody, welcome to UroChannel. I'm not quite sure if this is working because I switched to Windows 11 this week and all of a sudden all my settings were lost, and it's possible that you can't hear me or you can't see me, I don't know. So if you don't see anything, if you can't hear me, write me a comment in the chat so that I can see it. So in this case I will have to quit today and just to make this work until next week. So if you can hear me, once again, thank you for watching UroChannel and for joining me on this live stream tonight, where I will be covering testosterone, everything that you don't want to hear. The title is because I was thinking about what could I do for this live stream tonight, and I was discussing with my wife, and she said, when we were talking about testosterone, well, you never say what they want to hear. And I say, well, that's right. I'm so sorry for that, because that's not so successful as I could be, but I can't lie. That's the problem. I can't promise you anything, so I can't say eat this beetroot and your testosterone will be on top, or if you work out you will boost your testosterone and then you will be the manliest man and you will have lots of muscle and everything. So I don't know, I just can't say that, because testosterone works totally different. And I've been working with testosterone for many years. I have patients who are on testosterone deficiency, whom I treat with testosterone, who got testosterone substitution. And when we look at testosterone replacement therapy, it works in some people and some patients, but it's not that wonder of what you think would happen. So what if you just start at the beginning? So testosterone is a hormone, and testosterone is the hormone that defines man, as a matter of fact. So without testosterone, everybody of us would be a woman, because nature is female. So because of testosterone, some fetuses become boys and then eventually men, because in their genes there is a genetic code for the production of a hormone that is called testosterone. So this hormone defines how this bunch of cells, as we all start off, eventually shapes, and what organs then will be constructed or built. And this is what testosterone does. And for a man, testosterone is very important to maintain that function, to maintain function of typically male organs, maintain function of being able to function as a whole. So without testosterone, we get very tired, we get weak, we don't think that life is good, we think life is bad, and we also suffer in our sexual function. So therefore we need testosterone. But if you look at the range of testosterone, there's a huge range where there's a minimum and where's the maximum, and everybody kind of like finds themselves in between this range, so to speak. So the first misconception is that if you somehow increase your testosterone, that you will feel it. You won't. That's the simple truth. I'm so sorry about that. Okay, thank you. See and hear just fine. Because within this very huge range, there is no difference. You won't be able to feel that. And even if you could increase your testosterone a little bit, you won't be able to feel that. So the only way to feel a testosterone surge would be to supplement it. So we are talking about doping, where you inject testosterone or anabolic steroids, then you will most likely feel some kind of a difference. But if you stay within limits, there's nothing that I would say benefits you. So and we don't even know what testosterone means. So it's very complicated. If you look at biological processes, it's not very mechanistic. It's not like you increase testosterone and then this and this happens. we know that testosterone is rising after a workout. So if you have a bout of workout, then testosterone will increase for about half an hour or so. This most possibly has something to do with anabolics in our body, because if you train, then your body will react, and muscle will react with becoming stronger, and most probably testosterone has a function within that. But there's so much more that we haven't figured out and that we don't know. I get a lot of comments saying, how can you say you don't know? Because medicine knows everything. And I'm so sorry to tell you, we know maybe 5% of what's going on. So there's so many things that we have no clue what is happening. And if you break it down to basic research, and we see all these pathways and all these molecules and hormones and stuff interacting, yeah, we can say we kind of see like an interaction, but on a very microscopic level, and we don't really know what this means for the whole body and for what we can do to have an influence on this. This is very complex, and it's not very easily that you can explain why things happen and how they work together. I think one day maybe eventually we'll figure it out, but we are far from doing this right now. So, and this also applies to testosterone. The only thing that I can say is that when you pass a certain threshold and testosterone goes lower than, like, it's the consensus is 12 nanomoles per liter, then most probably you start to feel things. And the first thing that will go away is libido, sexual desire. But testosterone is not the only driver of sexual desire. There's so much more to it. So just to say, I have no sexual desire, therefore my testosterone is low, that's oversimplistic, and I would say that's outright false. Sometimes it can be that way, but very often it is not. And if testosterone drops even lower, then you will kind of feel it like with depressive thoughts. Maybe you will become weaker. You will feel that you are not as, you don't feel as strong as you felt before. Yeah, you don't want to move, you want to sit around, stuff like that. You gain weight. That's something that's also a common symptom of testosterone deficiency. And this can happen once you cross the 45-year barrier, because some men then start to lose more testosterone than others. As a rule, you will lose about 1% per year, and this will be enough for most men. So even if they go down in their testosterone levels, it'll still be enough for them to function well. So we don't want to substitute them, but we want to substitute men who really have a deficiency. And in order to diagnose a deficiency, you will have to draw blood in the morning hours several times. Testosterone can change around very much, so you want at least 2 samples before you can confirm that this is a testosterone deficiency. And when you look at it, you will also want to know why this is happening. So you will look at the trigger of testosterone, like it's the LH, the luteinizing hormone. This is a hormone that's produced in a small gland in the brain. It's behind the nose somewhere here, which then will once a day in the early morning hours release this hormone. And this hormone will travel to the testosterone, to the testicles within the blood, and it will tell the testicles to start producing testosterone. This trigger can be disturbed, for example, also by obesity, so that this is not working properly. There are several scenarios why this may not work. So it can be normal, it can be low, it can be high. So if it's high, it's a sign that maybe the testicles are not responding. And this is why it's high, because it really wants to tell the testicles now start producing testosterone, and they don't. As I said, if it's low, it can be a sign of the metabolic syndrome, which then suppresses LH release, and then testosterone is low as well. So you want to look at that. You want to look at prolactin. It's another hormone that's produced somewhere here. That also can suppress testosterone release. The thyroid is very important. And you want to look at all of these factors to determine whether this could be a real testosterone deficiency. And then I am open to testosterone trials. So I put them on testosterone for 3 months and then I see what's happening. There's a common misconception that erectile function will go down once testosterone crosses a certain barrier. I don't think that's true. I don't see this in clinical practice that often. I see a very weak correlation between erectile function and testosterone levels. And there was also a recent Cochrane review looking at testosterone replacement therapy in terms of having better erectile function, and they didn't find a very clear connection between replacing testosterone and better erectile function. Nevertheless, if there is testosterone deficiency and if there is erectile dysfunction, I have a tendency to try to replace testosterone to start with, because we know from research that things like Viagra, Cialis, all the PD5 inhibitors, they will work better if testosterone is in the low normal range, so to speak. And this is why one could do a trial with testosterone. But as a rule, I'm not very satisfied with the outcomes. Very many men report back to me that they don't feel a thing. Even after half a year on testosterone replacement, they don't see a difference. Sometimes I ask the spouses, because they are very important in this equation. Spouses will tell you whether there has been a change, because these changes when you replace testosterone are so subtle and they happen over such a long time frame that maybe you're not taking note of it. So it changes so subtle that you won't feel it. And then there has been a change, and spouses very often will know about it. Let's see, I saw there were some comments. Energy, still no libido. Okay. So, anything that you can eat for testosterone, stuff like that, I'm quite critical of it because it wouldn't change much. So there are some, I saw a TV show the other day, a couple of months ago, about testosterone, and they were like having two guys being on testosterone, not being on testosterone, trying to boost their testosterone by working out, and they felt much better after 3 weeks. With one guy had like this much more testosterone, I don't know, and the other guy, he didn't. He was lower in testosterone, and they said they felt great. Yeah, because they were trained more. So don't confuse the effects of testosterone with training effects, and they confused that in that show. So this is one of the other points one has to be observant to. If you sleep better, if you have more energy because you train more, then you will be more alert and you will feel better. So training is a very important factor, but it's unrelated to testosterone levels. Where I think working out and training and nutrition can make a difference, that's in patients with obesity, because they have more body fat, and these patients will have a what can I say? They will have a transformation of testosterone into estrogens, and estrogens are the female sex hormones. This means that in the body fat, which is not just a calorie storage or energy storage, it's also hormonally active tissue. They will take the testosterone and change it into estrogens. This is important to know. And we know that patients who are with a metabolic syndrome, who are obese, who have diabetes, they very often have testosterone deficiency. This means that if you work out in these conditions and if you lower body fat and you normalize weight, then testosterone levels can be restored. And this is, in my opinion, the only way where there can be a meaningful change that you can implement, that you can really do without taking testosterone to do anything to the better. But if, which is the rule, there are normal guys who are lean, who are young, and then want to boost their testosterone, I don't see any sense in this because it's not working the way you think. It's not that mechanistic. This is one of the problems that I very often get when I talk to patients. Just have a look at the comments. For many years, side effects, interested, testosterone. Finasteride, yes. 3 different types of testosterone. I'm not quite sure. I only know 2. There's total testosterone, and then there is free testosterone. So testosterone is produced and then it binds to a protein, which is called SHGB. It's a sexual hormone binding globulin. And only the free testosterone is hormonally active. So everything that's bound is not very active. This is why you would calculate the free testosterone, and there are calculators on the web. You can just use them, and you put in the total testosterone and the SHGB, and then you get your free testosterone. So I'm opting for, like, if you look at the guidelines, it's something around 220 picomoles per liter. That's what I would like to see at the minimum for free testosterone. But there are also some older publications saying that it's something like 173, if I'm not mistaken, picomoles per liter of free testosterone, which is the lower threshold. But in the European guidelines of the European Association of Urology, it's always something around 220, 230. It changes a little bit during the years. Okay, this is not about testosterone, this is about urine. That's not today's topic. Finasteride, no. Available. I'm sorry, I just have to read some of the comments. Yeah, side effects. Maybe that's a good point. Are there any side effects connected to testosterone replacement? The question is, what are the side effects that you can get without testosterone replacement? Maybe we start with that, because that's equally important. If you have testosterone levels that are too low, you run certain risks. That's, for example, osteoporosis. That means that the bone mass will go down. You don't want that, because then you get fractures. With bone mass, it's a tricky thing. You gain bone mass in your early years. You're on top kind of like between 20 and 30, and then it will eventually go down. This is why you want to be very physically active in your youth, because it then builds your bone mass, and then it will, you will lose bone mass. You won't be able to build bone mass after a certain age, and then it will just drop off. But it's enough for everybody. I'm just a little bit worried about the young generations that don't do sports anymore, and so they sit in front of the computer or with their smartphones, so they don't move that much. So we'll see what comes out of that. That's the first point. The other point is that there is an increased risk of prostate cancer and of the more aggressive form of prostate cancer in men with low testosterone levels. This risk is increased, and also for cardiovascular disease, which is also increased in hypogonadal men. This is why you want to substitute with testosterone until you are in the low normal range. On the other hand, the things that you don't want is to cause some prostate cancer to wake up. So there has been discussion, can testosterone replacement therapy cause prostate cancer? And I have to say, we don't have evidence to support that. However, we are always very critical, and we're always kind of anxious not to give testosterone in patients who are at risk for having prostate cancer, like when there is an elevated prostatic PSA level, prostate-specific antigen, and you have a suspicion, then I would be very careful to give testosterone, and you have to monitor it. So my patients, they have a very close monitoring so that I can pick up any PSA rising on the way. That's very important. And you always have to check for certain blood parameters, like for example, the hematocrit, which is how thick the blood is. It can become thicker. Actually, I haven't seen it in reality, but I'm always checking that. And then you want to check some of the liver parameters. But as a rule, I don't see any bad things happening with testosterone replacement therapy. I like gels very much because you put them on once in the morning. It simulates the natural testosterone release that's happening once a day, as opposed to the injections. Basically, you have two types of injections. There's one that you give every week, and then there's one that you can have for 3 months. I think injections, the downside of injection is that you have to inject it as opposed to putting on a gel, because then you have to put a needle into your body, and there's always a risk for some infections that come out of that. I've seen some abscesses with injections of testosterone. You don't want to do this in, what can I say, in unusual places. I've seen the nasty injection injuries I've seen were into places where I wouldn't put in a needle. Like, for example, if you want to gain muscle, it's not a good idea to inject it like in the biceps. I don't know why people do that, or into the penis. There's no use in doing that. So there are other ways of doing it. So it's mostly the thigh where you could put this, or I prefer to put it in the glutes. This is a good spot for intramuscular injection. What else? Yeah, if you're using the gel, you have to wait a couple of minutes until it has been absorbed, because otherwise other people who can come into contact with that could also get their share of testosterone. So your wife, she doesn't want to get into contact with your testosterone, with your gel, because it will trigger beard growth if she's unlucky. Nevertheless, also women have testosterone. I'm not quite sure if you're aware of this. Women need testosterone also for their functioning, as well as men need estrogens. So it's not the way that we don't need estrogens. We need small amounts of estrogens as well. And women need testosterone, for example, also for sex drive. This is what happens when, after menopause, women lose estrogens first, but they retain some of the sex drive many years until it eventually goes down, because then testosterone drops off. And there were some testosterone replacement plasters. I don't think they're on the market anymore. So these things are very important if you think about estrogens and testosterone. They are important for both sexes, but in very different amounts. Just have a look at more comments. Fertility. Yeah, it can. I've seen patients where it didn't affect fertility. So, but as a rule, if you still want to have kids, then you would be cautious with external testosterone. What you can do is, for the time you want to conceive a child, then you change the switch to HCG, which is human chorion gonadotropin, which resembles the LH, the luteinizing hormone that I was talking about. You inject that, and then it's kind of like a central stimulus, which stimulates the testicles to work more. Then they will produce testosterone, and this will benefit fertility. And one thing I forgot about testosterone replacement, if you're doing this over many years, your testicles will start to shrink because they're not working anymore. They get lazy because there's no need to produce testosterone, and this will make them smaller. I've seen this quite a lot. What else about testosterone? Yeah, if you block testosterone, and now we're getting in taking away testosterone by will, and we do this in certain forms of cancer, like in prostate cancer. There are certain scenarios where you want to withdraw testosterone, then it will have an effect. You will feel flushes, like you will become sweat and hot all of a sudden. This is quite normal, and then you will gain weight. You will feel very tired. These are the common symptoms I see when we withdraw testosterone. You want to do that. We've gotten more cautious about this in prostate cancer. So when I started off as a resident, we were doing this very often, but now I'm mostly doing this when there is, like, for radiation, and if there is a advanced prostate cancer that needs radiation, then we would block testosterone for a couple of years. There are some scenarios where you want to do that, but we're not as eager in doing this anymore as we used to. See some more comments. Yeah, fertility. Yeah, this is a question about bioavailable testosterone. That's the free testosterone I was talking about. So no more questions. In case you haven't subscribed, it would be very nice if you subscribe to UroChannel. It would be nice for a change because I'm losing subscribers with every live stream I do. Up to now, I think I've lost almost 100 subscribers by live streaming. So it's the opposite of what I was hoping for. So if you haven't subscribed, please subscribe so that I don't lose subscribers with this live stream. If you want to become a member, that would be very nice too. You can support me for my work with $1.99 per month. I have some plans for memberships, but I won't reveal anything at this point. So maybe this is going to be very exciting this year. I have to check some points before I can release that news. If you are a member, and I've seen there's one member already who's watching this live stream, thank you very much. I'm really glad you are a member, and I can promise you, as you have seen, I just released a video just for members, and I will post more just for members. And as I said, there's something coming up that I want to implement in the memberships first. What's in the pipeline for tomorrow? Tomorrow is going to be penis again. So look forward to a very exciting video about the aging penis that I did. Maybe a little bit controversial for some of you, I would guess. As you know about nutrition, I was talking about this. So by the way, testosterone, is there any supplements you can take, any nutrition to boost your testosterone? I would say no. Body works just fine. You just have to feed it the right food, and then it will take care of itself. So stay away from any kind of junk food if you can. Drink little alcohol, because alcohol will decrease testosterone. So I would say lots of antioxidants is a good thing to to eat, and they are in fresh stuff. So start cooking. That's maybe it's a good advice to start prepare food, fresh food. And I know this, especially in the States, it's in some places it's very difficult. I watched a movie where they were talking about food deserts, because you can't get anything else but fast food. So if you have a farmer's market, maybe you want to have a look at it and see what kind of vegetables they have and healthy stuff that you maybe can cook. So it would be a good start to cook something fresh and not put something in the microwave oven. This is for tomorrow. It's about the penis, what you can do to help me do my job, so to speak, because there's a foundation to what I'm doing when I do, like, for example, treatments on erectile dysfunction. There's a lot my patients can do, and where I tell them, well, you can help to make this outcome a little better. So I'm talking about this tomorrow in my video. What else? I'm producing a lot of videos. I had a video on testicular masses on Wednesday, which I think is a very important topic. And I always get these comments when I have a very popular topic. So why don't you quit talking about the penis? We don't want to hear about this. And as soon as I post anything valuable, like about scrotal masses, nobody's watching it. So there's something wrong here. Maybe I shouldn't listen to these guys who tell me to stop posting about the penis. Because scrotal masses are very important. I get this all the time, that I have patients who come in and say, okay, there is something in my scrotum and I don't know what it is. So if you haven't seen that video, check it out, and to watch the differential diagnosis that are possible. So I will try to stream next week. I'm still thinking about streaming earlier in the day. I didn't make it today, so maybe next Friday, but I will announce it when I change my times. So looking forward to seeing you there next week. Thanks for watching. Have a good night. Have a nice weekend.